The first and foremost thing is that if you are sick and you have symptoms, not only do we want you to get tested, but most importantly, we want you to exclude yourself from others, to stay away from others, to not go out and expose others, to really do everything you can to protect yourself, your loved ones, and those around you. So as you can see here, the first and foremost thing is we want to make sure, as we are, and I know many of you have heard from our hospital partners this morning, that we are having a very difficult time in our emergency departments and our hospitals across the healthcare system, across the state of Washington. That means that we want to assure that people are only going to the emergency room or emergency department. Dr. Fotinas can speak on this as well, if they have an emergency. That does not mean that you go to the emergency department to get tested. That does not mean you go to the emergency department because you had a positive test and you're thinking that you might want to get it confirmed. That is not the reason to go to the emergency department. The reason to go to the emergency department are things like what you're seeing here. When you're having a true emergency, whether it's emergency from respiratory disease, whether it's chest pain, whether it's some other symptom that is causing you to have an emergent issue, we absolutely want you to contact 911, call 911, and/or make your way to the emergency department. But we do not want you to do that if it's not an emergency. So this is so critical to our healthcare system. If you have a home test, and again, we're working and more details will be coming on this with the additional 3.5 million tests that we have ordered. If you do have access to a home test, please, if you have symptoms or you've been exposed to someone, please use the test. If you don't have one, as Lacey said yesterday, it's like band-aids that, you don't wait for needing a test, you plan ahead and you get the test, and you do everything that you need to do to be able to have that test in your home so you can get tested. So I'm going to let Lacey talk more about that, but I think the key message here is that if you test positive, we want to make sure people are doing everything they can to, one, stay away from others, but also, number two, to be isolating or quarantining depending on whether they have symptoms or not. We have a number of pieces of information that are going to be going up on our website, but this is in summary what we want people to do. The CDC guidance, as you know, has evolved over the last week or so, and we want to make sure people are aware of the evolved guidance, the new guidance. Our guidance for Department of Health has also evolved, and so the guidance for isolation quarantine, if you could keep that slide back up so I can read it, that would be great. But we also want to make sure that not only are people doing that, but they're also wearing the mask whether in home, and they're also doing the things to stay hydrated, using over-the-counter medications, and certainly being in areas that are ventilated, so we can really assure that people are not going to be in a situation where they're going to get themselves or others in trouble from COVID-19. Now you can take it down. We know there are constraints on our system, especially when it relates to testing. We also know it's related to vaccine appointments, although again, that is improving with the efforts that we have made alongside with our partners. And we know that's the case for the healthcare system. We ask all Washingtonians to please do your part. Please be patient. As we know, there may be some interruption of services. There may be a point where it may take you longer to do something than you otherwise would do. We ask you to help each other, help someone, help a neighbor, help somebody in your community, especially as a very difficult time from a mental health standpoint for a lot of people, a lot of stress in the system. We want you to do whatever you can to help each other, and certainly empower yourself by knowing when to seek care and really keeping in mind what's happening in the healthcare system. Again, we are here to help. We have put forth policies, guidance, support, materials, supplies, resources. Again, back to the governor's announcement yesterday, all of the different support and actions that we have given for vaccines and community testing, at-home testing, masks, everything else, including the support in our healthcare system. All of this really comes down to one comment: do your part. Know what's happening, Yes, it's going to be difficult, but ultimately we are going to get through this difficult time together. And I just want to thank everybody for continuing to really work with us 2 years in. I know we are hashtag Washington strong and we can do this, but we need to continue to be patient with each other and work with each other.